Good evening, everybody. This is Nurse Jackie, and tonight we will be going over the body systems for CNAs. We want you guys to pass the CNA exam. If you guys haven't done so already, be sure to check out the website at www.fltraining.com. There are free CNA practice tests on there. There's a multitude of things for you guys to go through to have resources on there. So I'm going to go to the next slide here. So tonight we're going to talk about understanding the body systems. So even though CNAs don't diagnose or prescribe, your care directly impacts the systems like the skin, lungs, and the heart. Knowing what's normal helps you spot when something isn't. So here are a few reasons to learn about the body systems. CNAs provide hands-on care that affects every body system. Understanding basic anatomy helps CNAs recognize normal versus abnormal. It improves communication with nurses and the healthcare team, and it enhances resident safety and dignity. So just going through the 11 human body systems, the integumentary system, the CNA's role is to prevent pressure sores, assist with hygiene, and observe for skin breakdown. The muscular system is the CNA's role is to support ambulation, which is walking, range of motion exercises, and to prevent muscle atrophy. And the skeletal system, the CNA's role is to use gait belts, prevent falls, and protect fracture-prone residents. With the nervous system, the CNA's role is to observe changes in alertness, assist dementia patients, and ensure safety. With the endocrine system, the CNA's role is to be aware of diabetic care plans, observe for sweating or shakiness. And with the cardiovascular system, the CNA's role is to monitor the blood pressure and pulse, report swelling, and help manage CHF residents, and that CHF stands for congestive heart failure. With the lymphatic system, also known as the immune system, the CNA's role is to prevent infection, follow standard precautions and isolation protocols. And as you all know, our number one way to prevent the spread of infection is hand hygiene. The respiratory system, the CNA's role is to position for easier breathing, monitor oxygen, and assist with coughing and deep breathing. The digestive system, the CNA's role is to assist with meals, monitor bowel habits, and report nausea and vomiting. The urinary system, the CNA's role is to record intake and output, perform perineal care, catheter care, and with the reproductive system, the CNA's role is to maintain dignity during pericare, understand age-related changes, and assist with toileting. So you are the eyes and the ears for the nurse. If something is off, which you're often the first person to see it, the more you understand the body systems, the more confidently you'll report it, which you guys know overall that would lead to better care outcomes and more patient satisfaction. With the urinary system, the CNA's role is to record intake and output, perform perineal care and catheter care. And with the reproductive system, the CNA's role is to maintain dignity during pericare and understand age-related changes and assist with toileting. And at the top of this slide here, it says early warnings equal better outcomes. So the sooner that you notify the nurse so that they can do their assessment on the patient, that's the better the outcomes will be. So we want to not delay anything. We want to report immediately. I see a lot of people saying hi in the comments. Good evening, everybody. I see a couple of people have passed their test, so congratulations on that. Someone else asks, is this good for the state of Florida or will it work for Virginia? Anybody can tune into this. You can even be in a different country and you'll learn something from this. So thank you for tuning in, Kaya. Let's see. Also, we have Marie says that she passed her CNA test. Congratulations with that. And hello to everyone. And Siobhan also passed. So congratulations, you guys. Keep up the good work. I'm glad to hear the good news. So here you guys, we have a free ebook with 11 body systems. So if you guys want to feel more confident during your class or exam, make sure that you grab your free study guide that's packed with essential tips and key information to help you succeed. Definitely visit the website at www.nurseeunice.com to download. This is perfect for CNAs and nursing students, CPR instructors, and healthcare professionals. So let's get ready for your practice test. We're going to build your confidence. But before we begin, I want you all to find a quiet space to focus. Have a notebook or scratch paper ready. Read each question carefully, and definitely trust your instincts. You already have the heart for patient care. So we will be going over 25 questions tonight. You also grab your pen, grab your paper, put your thinking caps on, and let's go. So the question number one, first question, which body system is responsible for transporting deoxygenated blood back to the lungs? A, the respiratory system, B, the digestive system, C, the cardiovascular system, or D, the nervous system? Omi says that they're about to sign up for the test. You're nervous. Just do your best and, take all the knowledge with you that you've obtained and do the best that you can. And good luck with everything. I'm sure you'll pass. I'll give you guys about 5 seconds to complete this answer. In 5, 4, 3, 2, and 1. The correct answer is C, the cardiovascular system. So the cardiovascular system moves blood through the body. It carries deoxygenated blood, which is blood without oxygen, back to the lungs so it can get more oxygen. The heart and blood vessels do the transporting, not the lungs, brain, or stomach. So another note is CNAs help checking vital signs like pulse and watching for signs of poor blood flow like cold hands or swelling. So if you guys know any of those things, be sure that you report that to the nurse. Also, with this question, just going back to the different answer choices, you guys be sure to use your process of elimination. So, this question is asking about bringing blood. So when you see that blood, I would think, okay, which one of these systems have to deal with blood? So I would think the cardiovascular system. So be sure to use that process of elimination whenever you're filling out your answers. Question number 2. The skeletal system serves all of the following except. So the key word on this question is except. So we're going to select the answer that's incorrect. So A, protecting vital organs. B, producing blood cells. C, providing structure and support. Or D, filtering waste from the blood. I'll give you guys about 5 seconds to answer this one. This is for the CNA exam, but you guys, there's so many things. As long as you understand with healthcare, you may have a similar question with the PCT exam, but tonight, this is for the CNA exam, but you will definitely learn from it, whatever your background is. All right, let's reveal the answer in 3, 2, and 1. The correct answer is D, filtering waste from the blood. So filtering waste is the role of the kidneys in the urinary system, not the skeletal system. So you guys know the skeletal system. In my brain, I'm seeing a skeleton whenever I say the skeletal system. So that automatically makes me think skeletal system has to do with the bones. So I would know that that's not the correct answer there. So kidneys help filter waste products. And then we also know, like whenever our patients are on dialysis, their body is not able to filter those waste products. So we've seen different photos of that where a patient's on dialysis and it's doing the filtering. So good answer there. Question number 3. The largest organ in the body is A, the heart, B, the liver, C, the brain, or D, skin. Give you guys a few more seconds to answer that. Okay, in 3, 2, and 1. The correct answer is D, the skin. The skin is the largest organ in the body and is part of the integumentary system. So moving forward, if you didn't get this answer correct, be sure to write it down. And one way to remember what's the largest organ of your body, if you cross your arms over, touch your arms, you know you're touching the largest organ because your skin is everywhere. So that's what I used to do when I had a question like that. I would think, and my arms would be touching, and I would be like, oh, this is the largest organ because it's literally everywhere from my head to my toes. Okay, question number 4. What is the primary function of the respiratory system? A, absorbing nutrients. B, delivering oxygen to the cells. C, producing hormones. Or D, protecting the body from infection. Okay, let's reveal this answer in 3 seconds. In 3, 2, and 1. The correct answer is B. Excellent job, you guys. Delivering oxygen to the cells. So the respiratory system's main function is to bring in oxygen and expel carbon dioxide. So another thing, like if your nurse tells you to practice respiratory hygiene or something like that with your patient, you know, you could have them cough and deep breathe. That will help clear up the lungs. Another thing you can do is whenever they're sneezing, make sure that they're sneezing into like their arm or their shoulder, somewhere where they're not sneezing into their hands, because, you know, we could be passing on whatever they have with the hands. So those are just a few things with them. Question number 5. Which body part is part of the central nervous system? A, the spinal cord. B, the lungs. C, the kidneys. Or D, the liver. Give you guys a few seconds to answer that. In 5, 4, 3, 2, and 1. Our correct answer is A, the spinal cord. So the central nervous here, the CNS, that would be the central nervous system. And one way to think about that, it's at the center of your body. If you draw a line from your head to your toe, then you have your central nervous system. So it's our brain and our spinal cord. Question number 6. What is the main function of the digestive system? A, pumping blood. B, removing toxins. C, breaking down food and absorbing nutrients. Or D, producing hormones. You guys about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is C, breaking down food and absorbing nutrients. The digestive system processes food, breaks it down, and absorbs essential nutrients. You guys, where does somebody tell me in the comment section, where does the digestive system start at? Give you guys a few seconds. I'm just patiently waiting on somebody to tell me. And I know you guys all know this. Yes, Catherine. Great job. In the mouth. So say that I have a piece of candy or a banana or something that I'm going to get ready to eat. I'm putting it into my mouth, and that's when the digestive process starts, because I start release the enzymes in my mouth to help break down my food. Then it's going to go down my throat, and it just keeps going down, and it ends in whenever it passes out of the rectum. But Marie, that was still good. It's still part of the GI system, but it's because it's the gastrointestinal. But we're going to start in the upper, so we're going to go with the mouth. So as soon as you put something in your mouth, that's when the digestive system or the digestive process begins. So excellent job there, you guys. Question number 7. The urinary system is primarily responsible for A, removing waste products from the blood, B, circulating oxygenated blood, C, protecting the body from infections, or D, regulating hormones. Digestive juices start in the mouth. That's correct. That is correct, you guys. Good job for thinking that through. Definitely using critical thinking with that. Give you guys about 5 more seconds to answer this. Okay, the correct answer is A, removing waste products from the blood. So the urinary system, including the kidneys, removes waste products and regulates fluid balance. So remember, like urine is a waste product of the body. Our body needs to get rid of waste. So that's one way that it does is by us urinating. So in urinating, same as voiding, or you guys may use, hear somebody just say peeing, but we try to use our medical terms. But in layman's term, if you say, oh, did you void today? They may not know what you mean, but that's correct for that one. So what is the main function of the lymphatic system? A, transporting oxygen, B, filtering blood, C, producing hormones, or D, fighting infections and maintaining fluid balance. Give you guys about 5 more seconds to answer that. Okay. And the correct answer for this one is D, fighting infections and maintaining fluid balance. So the lymphatic system is part of the immune system, which help fight infections and regulate fluid balance. So one thing that I like to do whenever I feel like I'm getting sick is I touch my lymph nodes and my neck, and I kind of try to put like a warm cloth on them to help them drain better, and then I just kind of massage them to help me feel better. Um, just to show you guys, put my camera on. So like right through here in your neck, whenever I get sick all the time, like right in through there, my lymph nodes are swollen. That's because that's my body's response to try to help me defeat the sickness that I have going on. So I just kind of massage them like this and put a warm cloth on them, and that'll help drain some of that lymph fluid there. All right, guys, question number 9. Which of the following is not part of the musculoskeletal system? A, the bones, B, cartilage, C, muscles, or D, trachea. So again, the question is asking what is on. All right, and 2 and 1. All right, guys, so we were on question number 9, and it was asking which of the following was not a part of the musculoskeletal system. And the correct answer was D, trachea. So the trachea, also known as the windpipe, is part of the respiratory system, not the musculoskeletal system. The musculoskeletal system includes structures like bones, cartilage, ligaments, tendons, and muscles, which support the body and enable movement. The trachea's main function is to carry air to and from the lungs. All right, question number 10. Which body system includes the brain, spinal cord, and nerves? I'll give you guys about 5 seconds to answer this after we go through the choices. A is the endocrine system, B is the nervous system, C is the respiratory system, or D, the digestive system. All right, let's go ahead and reveal that answer. The correct answer is B. Good job, you guys. The nervous system. So the nervous system controls bodily functions and responds to stimuli. So the nervous system is very complex. You have so many different nerve endings all throughout your body. One thing that you guys may see is whenever a patient has diabetes, they may have neuropathy, which is where they have nerve pain. So they may say, oh, the back of my leg is hurting or my feet are tingling. That may be due to the neuropathy from the diabetes, but still, that's still something that you guys will want to report to the nurse because there could be something more going on with that patient as well. Question number 11. Which part of the heart pumps oxygen-rich blood to the body? A, the left ventricle, B, the right ventricle, C, the left atrium, or D, the right atrium? Give you guys about 5 seconds to answer this one. And 5, 4, 3, 2, and 1. The correct answer is A, the left ventricle. So the left ventricle pumps oxygenated blood to the body through the aorta. So in the photo to the left, as you guys can see, the upper chambers of the heart, those are called the atrium. So we have the left and the right, and in photos, it's an interior view, so it's opposite of what yours is. So as I'm sitting here looking, it looks like it's the right when I stick my hand out, but it's going to be opposite in the photo there. That's the interior view. So upper chambers are the atrium, the lower are the ventricles, and like the question said, the left ventricle pumps the oxygenated blood to the body through the aorta. So atrium are on top, and I remember A comes before V, so that's how you can differentiate. Atrium is on top, and then V, ventricles, are below. Question number 12. The pancreas plays a role in which two body systems? A, endocrine and digestive. B, endocrine and circulatory. C, respiratory and digestive. Or D, skeletal and muscular. Give you guys about 5 seconds to answer this one. And 5, 4, 3, 2, and 1. The correct answer is A, the endocrine and digestive system. So the pancreas helps with digestion and regulates blood sugar by producing insulin. You guys also know if people are diabetic, sometimes their body has issues creating insulin, so they have to get that through a medicine form or, through injectable. Or sometimes people, if they still create some insulin, they can have a pill form to help with that. But those are some different things that you'll see with them. Question 13. Which body system produces hormones that regulate growth, metabolism, and reproduction? A, the integumentary system. B, the cardiovascular system. C, the respiratory system. Or D, the endocrine system. Give you guys about 3 more seconds to answer this one. In 3, 2, and 1. The correct answer is D, the endocrine system. So the endocrine system releases hormones that control various body functions. So in the photo to the right there, it shows different glands, hormones, and functions of the endocrine system. So we have the thyroid gland, the thymus, pancreas, adrenal gland, testes, ovary. There's so many things involved in the endocrine system. So sometimes if you may hear a patient say, I have an appointment today with my endocrinologist. They could be going for so many different things, but these are all different things that they deal with. They help control hormones, help with diabetes, thyroid gland. So if somebody has a hypo or hyperthyroid, they may be seeing that client as well. Question number 14. Where does gas exchange occur in the lungs? A, the bronchi. B, the alveoli. C, trachea. Or D, the diaphragm. Has about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is B, the alveoli. So alveoli are tiny air sacs where oxygen is exchanged for carbon dioxide. In that photo over there, it looks like little popcorn balls over here. That's what I think of when I think of alveoli. So These are the little tiny air sacs where oxygen is exchanged. So in your lungs, it's a very complex process. We want to breathe oxygen in and breathe carbon dioxide out, and those things will help us do that. Question 15. What is the primary function of red blood cells? A, to fight infections. B, clot the blood. C, carry oxygen to tissues. Or D, produce hormones. So there's a few different type of blood cells, but we are wanting to know, what do the red ones do? Give you guys about 3 more seconds to answer that one. In 3, 2, and 1. The correct answer is C, carry oxygen to tissues. So red blood cells, or erythrocytes, are another name for them. They transport oxygen from the lungs to the body tissue. So going back here, looking at these answer choices. So option A, I saw a few people pick that. White blood cells are the blood cells that are responsible for fighting infections. So I'm trying to think of an easy way for you guys to remember white blood cells help with infection. Think of it like this. Whenever you're coughing up mucus, whenever you're sick, most of the time it's like a yellowish white color. You could think of that like, okay, my white blood cells are helping me fight this off. And then red blood cells, those are to help carry oxygen. So what makes them red is the hemoglobin molecules in there. So just think red and oxygen to go together, if that makes any sense. Whenever I think of things, I just always try to do visuals in my head to try to be able to help me whenever I'm taking a test, so I can just sit there and try to think things through. Question 16. What organ filters toxins from the blood and produces bile? A, the pancreas. B, the kidneys. C, liver. Or D, stomach. Give you guys about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is C, the liver. So the liver filters toxins and produces bile and helps regulate metabolism. So the liver, there's a lot going on in the liver. In the photo, the picture that's red, or the part of the picture that's red, that's what the liver looks like. So the liver has, it'll help break down those toxins, help produce bile, and help regulate metabolism. So all things that are very important. What part of the brain controls balance and coordination? A, the cerebrum. B, the brainstem. C, the hypothalamus. Or D, the cerebellum. Give you guys about 5 seconds to answer this one. So as you guys can see, knowing the body parts and the functions are very important. So be sure that you guys know this information. Let's reveal this answer in 3 seconds. In 3, 2, and 1. The correct answer is D, cerebellum. So the cerebellum is responsible for balance, posture, and coordination. So at the lower part there, the one that's in purple, that's where it's showing the cerebellum. And I just think of it as cerebellum. For some reason, I think of like a ballerina, and with balance, and I think it's just the in the middle of that. So I think, oh, if my balance is off, then I'm thinking cerebellum. Like, a ballerina, they have great balance. So their cerebellum has to be great in my head. That's what I believe. So that's just a way to try to remember that one. Question number 18. What is the function of the white blood cells? So we went over this one. So let's see if you guys remember. To transport nutrients is option A. Option B, to fight red blood cells. Option C, to fight infections. Or D, aid in digestion. Give you guys about 5 seconds to answer them because I know you guys remember what I just told you. And I know you already knew the answer before that. So let's do in 3, 2, and 1. Great job there, you guys. So C, help fight infection. Your white blood, if our patient is sick, their white blood cell count is going to go up. It's going to increase because the body is gearing up to fight off this infection that they have. So you will see that white blood cells will be elevated when people are sick most of the time. Question number 19. Which body system includes hair, skin, and nails? A, the integumentary system. B, the external system. C, the lymphatic system. Or D, the muscular system. Let's see, Becky said, for all you do for this community. Now, did you help me pass my CNA exam? I also passed my BLS exam recently, first try by just watching your video. So excellent job there. And thank you guys for the feedback. There are so many videos that Nurse Eunice has taken her time to give you guys detailed information and giving you great feedback. So be sure to check out the website. There's so much information on there, so many great resources. So thank you guys for letting her know how well she's doing. All right, guys, so that correct answer is A, the integumentary system. So the integumentary system includes hair, skin, and nails, which protect the body. That's such a cute little baby there. Question number 20. The diaphragm is involved in which bodily function? A, digestion, B, urination, C, circulation, or D, respiration? Got about 5 seconds to answer this one. And 5, 4, 3, 2, and correct answer is D, respiration. So the diaphragm is a muscle that helps with breathing by expanding and contracting the lungs. So when you guys see that word, know that it has to do with the respiratory system, the diaphragm. Is anyone else having any issue hearing me? If so, please let me know in the comment section. I'm not sure. What? All right, we'll keep going. So which organ stores urine before it is expelled from the body? I see you guys are selecting answers there. So A, the kidneys, B, the urethra, C, the bladder, or D, the gallbladder? Okay, thank you guys. And lots of people answered, so we'll just go ahead and reveal it. And the correct answer is C, the bladder. So the bladder stores urine until it is eliminated from the body. So the picture shows a picture of the bladder, and it looks like it's pretty full. So before we urinate, it's stored in the bladder. Whenever we urinate, it's released from the bladder, which it goes through the urethra to leave our body. All right, question number 22. Which part of the eye allows light to enter? A, the retina, B, the lens, C, the cornea, or D, the pupil? You guys about 5 more seconds to answer that. And 5, 4, 3, 2, and 1. The correct answer is D, the pupil. So the pupil is the opening that allows light to pass through to the retina. So the arrow is showing the pupil in the center of the eye. Question number 23. Which of the following body systems can be affected by stress? A, the nervous and digestive system. B, the endocrine immune system. C, cardiovascular and respiratory systems. Or D, all of the above. A few more seconds to answer that one in 3, 2, and 1. The correct answer is D, all of the above. So stress can affect many body systems by triggering hormone release, increasing heart rate, and weakening the immune response, and disrupting digestion and breathing. So let's think about this. We're going to go back. Think about something that happens whenever your nervous system is affected by stress. You may see that a person's hands may shake a little bit, or with the digestive system, they may have an upset stomach or need to run to the bathroom because they're stressed. The endocrine system, with that, if a person's diabetic, their blood glucose may be elevated. Immune system, you can get sick more often due to stress. With the cardiovascular system, whenever you're feeling like anxious or just stressed out, the heart rate will start to increase. And also your respiration, so your breathing rate will also increase. So those are some examples of all of those, how your body systems can be affected by stress. Question number 24. What is the function of platelets in the blood? A, to carry oxygen. B, to fight infections. C, to aid in blood clotting. Or D, to regulate body temperature. Give you guys about 5 seconds to answer this. In 5, 4, 3, 2, and 1. The correct answer is C, aid in blood clotting. So platelets help in forming clots to stop bleeding. So guys know the clotting factors and all that stuff. So it's important that our blood clots, because if it didn't clot, we would just bleed all the time. So like with this little girl, she has a nosebleed, someone's helping her out. So the idea of it is that it'll stop whenever the blood clots. And let's see if you guys know this. So if a patient is having a nosebleed, do we want them to tilt their head to the front or tilt it back? And this has changed recently within the last few years, maybe even more than a few, but it used to be one way and now it's the other. So I want to make sure that you guys know what the correct thing to do is. If a patient is having a nosebleed, are we going to have them tilt their head back or to the front? Got a lot of mixed reviews in the chat here. Let's see, waiting on maybe 2 more. There's 1. And there's 2. So you guys, they changed it. It used to be backwards, but now they figure that we want to get that blood out of the system, and we don't want them to choke on it, because if we're holding the head back, it can go back down, and then they could have issues with this. So they have changed it, and now we want them to tilt their head forward. You want to pinch the bridge of the nose, and if you have like a cold compress, or you can even just do like a cold washcloth or something like that. And we're pinching the nose forward and we're waiting till that nosebleed stops. But you guys also know you want to report this to the nurse, because what if the patient's on a blood thinner? They need to know if they need to hold that blood thinner. They need to know if they need to reach out to the doctor for if maybe they need a different dose if they're on Coumadin or warfarin, things like that. So yes, definitely we want to tilt that head forward. And no problem. Thanks for giving me a chance to be able to teach you guys something new. We're always continuous learners, and all of us, every day learning something new is great. So glad that we all got to learn something new today. All right, question number 25. What part of the digestive system absorbs most of the nutrients from food? A, the stomach, B, the small intestines, C, the large intestines, or D, the esophagus? This is our last question of the night, you guys. Let's get it right. I know you guys can. So, in our digestive system, what absorbs most of the nutrients from the food? Give you guys 5 more seconds to finish that. In 5, 4, 3, 2, and 1. Our correct answer is going to be B. So this one's kind of hard. It's the small intestines. So the small intestines is the primary site where most of the nutrients from the digestive food are absorbed into the bloodstream. While the stomach breaks down food with acid and enzymes, the large intestines absorbs water and some vitamins. The small intestines handles the majority of nutrient absorption, and the esophagus only transports food to the stomach and plays no role in digestion or absorption. So, yes, the video will be saved. If you guys need to go back for future references, it will be on the YouTube channel. You guys go to videos, and then it'll be on there. And if you guys sign up to subscribe and receive notifications anytime there's a new video getting ready to come out, or even if it's one scheduled, it will be on there. And there are so many other videos on there that you guys can definitely look at on there. So that's question 25. So remember that caring CNAs make caring nurses. And of course, go check out the website at www.fltraining.com. And if you haven't done so already, be sure to like, share, and subscribe. And the channel is Florida Training Academy. And thank you so much for watching. Florida Training Academy is helping to prepare you all for success. There are CNA classes, CPR classes, NCLEX prep, and also instructor classes on there. So definitely check it out, and tell a friend to tell a friend to check it out. And you guys have a great night. I hope that everybody has a great week. If you guys are testing or anything this week, I hope that you guys pass with flying colors. And I will be back on Monday evenings. But Nurse Eunice also has, she usually comes on. So just definitely watch the website on there, and it'll tell you the next time that she will be on there, because there's always great content on here. So thank you guys for joining us, and I hope that you guys have a good night, and everybody take care. Thank you.